Okay guys, good morning. I am Katie Duke and I'm going to talk to you today about some of the differences in the types of nurse practitioner that one can become. So first and foremost is you have to make the decision to go to grad school. Now, grad school isn't for everybody. Not everybody wants to go back to school after they finish their bachelor's or their associates. And so in that case, then that would obviously be the most important decision to make first of all is, do you want to go back to school? If your answer is yes, the next thing that you need to do is figure out what type of nurse practitioner or advanced practice nurse do I want to be. And there's a lot of options out there depending on what your specialty is, what your interest is. So first and foremost, I'm going to talk about what I did, the program that I chose. So I chose Acute Care Nurse Practitioner. And the reason that I chose Acute Care Nurse Practitioner is because for the last 10 years of my 13 years in nursing, I worked in acute and critical care. I worked in a level 1 trauma and burn center. I worked in a level 1 pediatric emergency room. I worked in a CT ICU step-down unit, a neurosurgery step-down unit, and I've always had a really keen interest on acute and critical care. So that being said, I knew that my path would be down the Acute Care NP route, also known as the ACNP. If you want to work in the ICU setting, if you want to work in the step-down setting, if you want to work in the telemetry units, if you want to work in the hospital where the acuity of the patients is higher, for instance, the PACU, the recovery room, the operating room, the cath lab, the step-down units, all of those, the emergency room also, are considered the acute care areas. So if you want to pursue if you want to pursue a position in any one of those areas, the acute care would be the proper route for you. The second type of master's that you can get as a nurse practitioner is a family nurse practitioner. Now, family nurse practitioner is also known as an FNP. And when you get an FNP, what happens is you get a certification and training that deals with the entire spectrum of life from infancy into geriatrics. And so you can obviously take care of an entire family. Get it? So if you want to work in primary care, if you want to work in family medicine, if you want to work in internal medicine, if you want to work in an outpatient clinic setting, if you want to work in public health, if you want to work at a neighborhood clinic, if you want to work at a school, the FNP would really be a great route for you, because not only do you get training in the disease and illnesses and issues that affect the adult population, but you also get training in that which affects the pediatric population as well. However, you are not going to get a critical care-based education and training for the pediatric or adult population. So if you know that, well, I think I might want to go to the ICU one day, but I also want to take care of kids and adults, the FNP might be an okay route for you, but you will have to go back at some point in time for a postmaster's certificate in acute and critical care or pediatric critical care, which I'll get into a little later. So that's number 2, the family nurse practitioner, the FNP. Number 3 is pediatric nurse practitioner. Now, if you work in peds, you love peds. You never leave peds and you stay in peds. And I love peds nurses because I don't know if I could 100% full-time deal with sick kids, and it's very hard. It takes a very special person to do that. But if you are interested in peds and you want to work in the inpatient setting and you want to work in either critical care in peds, or you want to work in either, the peds general surgery floor, for example, or peds internal medicine, and you know that you only want to do pediatrics and you never want to mess with adults, I don't blame you. That you are going to go and you are going to do the PNP program, which is Pediatric Nurse Practitioner Program. Expanding on that, there is a neonatal nurse practitioner, which is pretty self-explanatory, where you are dealing with strictly with neonates. You're working in the NICU, you're working with preterm deliveries, you're working with infants in the very, very early stages of life. After that, you have the women's health nurse practitioner, which focuses primarily on women's health. So you can work in a women's health clinic, you can work in public outreach programs, you can work for Planned Parenthood, you can work for an OBGYN practice. You are specializing strictly in women's health. And as we all know, that in itself is a very, very specialized practice. Expanding on more, and the next thing that you can do is you can be a psychiatric nurse practitioner. And psychiatric nurse practitioners actually, it is a very specialized population because Psych NP is a lot of education. And it is a program that is a lot more credit hours than even your standard acute care or FNP program. And the thing being is that psychiatric NP is a very specialized population of patients that you're dealing with. However, you're going to have really good job security and job offers when you're done, because not everybody can work in psych. Not everybody can handle working in psych, and not everybody wants to work in psych. And so if you go to school and you are going to get a degree in, you're going to get a master's and you're going to specialize in Psych NP, just be prepared to actually have a really great job search when you're done, because, again, not a lot of people, tons of positions, great money, great hours, great jobs, but not a lot of people going to those Psych NP programs. But you can work in the prison system, you can work in psychiatric inpatient units, you can work in psychiatric program outpatient programs, you can work in day hospitals, you can work in adolescent or adult psych, you can also work in geri psych, which deals with Alzheimer's, dementia, Parkinson's, I'm sorry, not Parkinson's. But you can work in a lot of different spectrums of care. You can also work, in private practice as well. So there are many different options if you do like psych, and if you know that you want to be a Psych NP, there's a lot of great options there as well. So moving forward, another path for a master's prepared nurse, now that we have discussed acute care NP, pediatric NP, neonatal NP, family nurse practitioner, and psych nurse practitioner, and women's health nurse practitioner, is a CRNA. And this is for you people that love to be in the operating room. I am not one of them. I don't even know if I don't think I've ever even seen a surgery. I think I've been in the operating room maybe to observe something as a baby nursing student, but not my kind of place. However, if you love the ICU, if you love anesthesia, if you love when your patients are all intubated and sedated, which I know many people do, then a CRNA program might be the one for you. However, a CRNA program is different from your typical master's program. A CRNA program, you are not licensed as a nurse practitioner. You do not have prescriptive capabilities when you finish the program, but you are licensed as a CRNA. And with that being said, the programs are typically 2 to 3 years long, and they are full-time. You pretty much cannot work during these programs because they are rigorous. It's like you're in med school. However, when you're done, you can expect that you will have great money, great hours, and a lot of job satisfaction. I have a few friends who are CRNAs, and they love their life. They love it, love it, love it. So that's a good option. However, you have to have ICU experience, and you have to have at least 1 to 2 years of recent ICU experience, and you have to have recommendation letters. The application itself is pretty rigorous, so just prepare yourself and review that before you do decide if that's the path for you. Last but not least, and this is not offered at every school, but there is a program that specializes in adult and gero. These days, the adult and geriatric NP is actually combined with acute care, and they lengthened the program. So if you don't see any more specific geriatric NP programs, it's because they've combined a lot of the programs with the acute care. So you'll actually have a dual specialty with adult and gero acute care nurse practitioner as well. So that would explain why a lot of programs don't offer those anymore. And last but not least, there is also other tracks which are non-clinical but still master's prepared nurses. So what you can do is you can look up nursing informatics, which details the the IT and the tech side and the logistics side of nursing, how to make hospital systems work better for nurses. For example, oh my gosh, I'm totally drawing a blank right now. A lot of hospitals use Epic. Some hospitals use Allscripts. Some hospitals use Eclipsys. They need nurses, obviously, to give them input on how to make these programs better for the nurses who use them. Somebody who deals with nursing informatics will deal with the IT and the tech side of how a hospital uses its IT and tech to better work for the nurses. I hope that that's a good explanation. So that's nursing informatics. Another pathway that you can choose if you want to be a master's prepared nurse is, my God, the sun is like coming out right now and I feel like I'm getting blinded. Jesus. Okay. So another pathway that you can choose if you're going to be a master's prepared nurse is you can choose the nurse leadership or the nursing education route. Now, we need more nurse educators out there, and I mean, it is a very thankless field. Nursing itself is a thankless field, but being a nursing educator is the most important role in our entire system, honestly, because you are educating the nurses, you're educating the nurse practitioners, you're educating the CRNAs, you're educating the people who are going out there and taking care of the patients. So if you know that you have a special gift, if you know that you are a good teacher, if you know that you have great influence on other people, think about the nursing education route, because a lot of universities have great benefit packages and you can still teach clinically and didactically in the classroom, and a lot of people really have a great job satisfaction knowing that they are influencing patients by influencing and teaching the nurses and the nurse practitioners who will take care of them. And last but not least, we have nursing leadership. Now, nursing leadership is something that I wish more people would be interested in, but a lot of people just don't like administration and policy and politics, and not everybody can deal with budget and all those issues, and truthfully, it's not for me. You know from the beginning, is this right for you or is this not right for you? However, if it is, it would be something to look into, because when you take a position and when you choose to go and you get a master's in nursing leadership and a board certification in that, you know, you're really stepping into a role that is difficult and challenging. However, you have the ability to change things. You are not just a backseat driver. And listen, let's be honest. All of us have opinions, but not all of us are ready and willing to step out into the arena and actually rally for change. It's a difficult thing, and people are always scared of, you know, pushback, which is a very real piece of nursing. So if you know that you have some influential power and you know that you have an opinion and you know that you want to make change, think about the nursing leadership route. It might be the right path for you. So in summation, I hope that all of these little bits of information about how to choose what you want to do if you're going to pursue your master's degree and different options that are out there for you, I hope that these can get a little more clarification to everybody and help you make your decisions. And I'm always available. You can reach me anywhere on any of my social media pages. You can slide in my DMs. You can shoot me an email, and I'm happy to help. And good luck to you all.